All back. I want to read some of what this intake form looks like, Vaughn, if you want to work at the Health and Human Services Department for RFK Jr. Quote, the Make America Healthy Again intake form is certifiably comedic and a little gross. This is according to Puck News. The form asks candidates to answer questions by selecting responses such as, quote, I don't have much interest in having sexual experiences with another person. Quote, I believe in things many others don't, like having a sixth sense, clairvoyance, and telepathy. I don't even know how you say that one. I clearly don't have any. And as an adolescent, I had bizarre fantasies or preoccupations. And this, quote, I consistently use my physical appearance to draw attention to myself. When I reached out to the Trump transition team for comment, spokesman Brian Hughes confirmed the page is real and being used by Kennedy's team. What is the question? I consistently use my physical appearance to draw attention to myself, designed to attract or repel. I'm asking a serious question.
Yeah.
Is the answer designed to bring people in or push people out of HHS?
I think that there is a. I wish that I had a more specific answer for you, Nicole. Besides saying that, I think that there's a certain group of people that are around Robert F. Kennedy Jr. They have a following online, on podcasts that, frankly, has been elevated from fringe to a certain level of mainstream. And I think that there is an understanding of there's a certain small pocket of people that they entrust to work at the highest levels of HHS, CDC, FDA going forward here. But I think when they're looking at who's going to fill the roles of these political appointees on down, of which there are hundreds within the HHS, I think that is where these questions become pertinent.
Let me see them.
And I think
let's do it.
I want to believe you're reading it wrong because it doesn't.
I mean, you're a doctor, Dr. Anderson. I don't have much interest in having sexual experiences with another person. What information is it a management question or a medical question?
You know that it's rare that I'm at a loss for words. I'm just kind of coming up with other things on the checklist, like, do you have experience in taking care of patients or in public health or in making sure that kids are safe and well cared for? So I have no idea what that one means, but I would sort of like to add a couple others that I think maybe weigh a little bit more.
I think that's such a good answer, which is that, right? It's not just that this is wild. It's that there's an opportunity cost in not using the correct filter and not actually asking if someone, which is something we have seen with most of his nominees, right? Number one, do you have the experience and competence necessary in order to do this, to get this job done? Number two, are you fit enough to actually execute this job? That's sort of a testament. It's as though he used that same questionnaire on all of his nominees.
But that's the threat. The threat is that we are beginning with all of his nominees to normalize the absurd. I mean,
we're not.
Not we, but I'm saying they're moving the country there. The more they get away with this being done in terms of questionnaires are being said, and people are told, well, let's not talk about it or let's not deal with it. That normalized. This is not normal stuff. To ask people that are going to work at FDA or Health and Human Services about their sexual activity is nuts, and we need to deal with it like that.
I guess I don't want to be without curiosity about why Trump is attracted to this and why the voters who selected him, and he ran with RFK, so they knew this was part of the deal. I think there's some things where people say, well, I didn't really know Kash Patel would be the FBI director, which was also pretty obvious, but he campaigned with RFK. What does Trump think he gets if there's suddenly a resurgence of polio, measles, and mumps in America?
I don't think that that's what Donald Trump wants.
Are you sure?
I would give Donald Trump the benefit of the doubt. I mean that based off of, and others could disagree, and I'll just make the case. I think that Bobby Kennedy, I think that his team around him, I think they do truly care about the health of kids in the United States and overseas.
Which kids?
Of all kids.
And I think the kids in Samoa, where 93 kids died after he went and cast doubt on their vaccine program. Which kids?
And cast doubt. I think that this is where we get to in 2024. People are generally, and this is not just health related here, but this is about conspiracies and the questioning of government, of the deep state, of elections. I think all of these things are pulled from the same part of the brain, and people at their fingertips, they can go read a lot of material here, and sometimes that material is more intriguing than the peer-reviewed scientific research that has been on the books now for decades. And I think that that is where Robert F. Kennedy Jr. in the early 2000s, right, didn't have the same following that he does now, because I think that it's only opened up. It doesn't just come
from the brain. It comes because Joe Rogan spent time with RFK, not with Michael Anderson. I mean, it's not just that the brain is attracted to conspiracies, Dr. Anderson. It's that conspiracies have been peddled by some of the most prominent and heavily platformed celebrities in our politics.
And you're right. It's easier to go to the salacious podcast headline YouTube video as opposed to read the science or talk with your physician or nurse practitioner or really dive deep into these issues. It's an easier way out, but I keep coming back to that checklist. We've got to make sure that science and physicians and nurses and public health officials are helping lead this discussion, because kids are at risk. And Samoa is just a really great example of how things can go really south really quickly.
This isn't more from the New York Times. What the polio vaccine has meant for public health. And a lawyer advising RFK has asked the Food and Drug Administration to revoke its approval of the current polio vaccine, a successor to the Salk vaccine, because it has not been tested against a placebo.
Right. I actually wanted to ask the doctor about it.
I mean, that's not true, right?
Well, I just wanted to understand, because my understanding of it was when you go back to the original vaccine, part of it was they felt that it was incredibly immoral to withhold a vaccine that you knew could work from some parents and their children. But I think if what we're interested in is debunking misinformation, disinformation, Dr. Anderson, I think, can you just speak to that, to this idea of testing a vaccine against the placebo, given that that's the argument that Syria is making here?
It's amoral. It's immoral. It's dangerous, because once again, we have the facts and we have the evidence. And by the way, I just keep coming back to how many people do you know with polio? We have eradicated that disease. It is safe and effective. And any sort of revisionist approach to this is dangerous. Testing something that is known to be safe and effective against placebo, children can suffer and children can die. And that is just completely unethical.
I mean, we're doing this. Thank you for talking us through it, to both of you, Dr. Michael Anderson and Vaughn Hilliard. Do you think he gets through?
I do think he gets through.
I think they all do, yeah.